A second wave of COVID-19 is upon us already, according to Quebec's Director of Public Health. Well, how can Quebecers try to limit the spread of the virus? I'm Annie Demount for the McGill University Health Center's MUHC TV. We have Dr. Don Vinh, who is an infectious disease specialist at the MUHC and a microbiologist, of course, joining us to talk about what can be done. So, Dr. Vinh, let me ask you, first of all, what's most concerning about what you're seeing right now?
So what's concerning for us is that we're seeing an increase in the number of cases. Not only are we seeing an increase in the number of cases, but those cases that are positive are now affecting the younger population. So we know that between 19 to 49 years of age, that's about 45% of the currently positive COVID cases. And if you add the children in there, that's another 10%. So 55% of the population that's affected by COVID is now 49 years of age or younger.
Is it possible to control this second wave while maintaining a certain quality of life?
That is the question that everybody wants to know. And is it possible? Well, you don't have to look farther than the 1918 pandemic flu to know that. They had a second wave, and those areas which were adherent to the public health measures were able to come out of that second wave less unscathed than those that weren't. We need to have the capacity to test everybody who has symptoms and do contact tracing of their surroundings. And if we can do that, then we can apply measures to a few individuals or a few pockets of individuals rather than the whole society. The other thing we need for those tests is that they need to be rapid and reliable, right? If we can have tests that can be rapidly giving us an accurate result, they are reliable, and then we can get the report out quickly within 24 hours, ideally, then we can allow those who don't need to be in isolation to go back to activities, and we can keep those who should be in isolation. Because what we don't want is fatigue, where people are saying, well, I don't want to get tested, or I don't want to wait 4 days, or I don't want to do this, and then they go out and they contribute to the transmission.
Especially knowing how much of a bottleneck there is now in terms of getting people tested. Is there a right time to be tested? Are there people who maybe should stay away right now to make way for priority cases? I mean, what's the best time to be tested if perhaps you have been in contact with someone who's known to have COVID?
So that's a great question, and unfortunately, there's not one single best answer. Really, at this moment, the best thing to do is to contact the public health number, the 1877 number, and if they haven't contacted you, but you have concerns, and you should contact them. Because what you don't want is somebody who is, on the one hand, so overly anxious that they get testing when it's not necessary, and that contributes in its own way to the burden of the healthcare systems and the diagnostic labs. But on the other hand, you don't want somebody who should be tested and is dismissive about it and doesn't get tested and contributes to the transmission, which only perpetuates this vicious cycle.
Ontario right now is announcing the biggest flu vaccination campaign in its history. How much of a role is flu vaccination going to play in really controlling a second wave?
So the flu vaccine is going to be extremely important. It's going to be critical, really. We know that in general, the flu vaccine is about 50% protective, which means that if you get the flu vaccine, you have a 1 in 2 chance of becoming sick. And then if you do become sick, you also have a 50% likelihood of being less sick than if you did not get the flu vaccine. So the flu vaccine is absolutely critical. It's critical every year, but there could not be a better year where it would be important. Because what you don't want come October or November is you have a fever and a cough, and we don't know if it's COVID or flu or some other respiratory virus. And if we could put everything in our favor to make sure that it's not an infection that can make us sick, we should take advantage of that. And the flu vaccine will do that.
Okay, great. Thank you so much.